The Progressive Professional Forum is disappointed by the utterances made by South Africa's Finance Minister Enoch Godongwana recently about the National Health Insurance Bill. Godongwana made the comments during News 24's On the Record Summit, stating that the country requires some form of universal health coverage, but at present the NHI lacks a sustainable funding source. He added that he would prefer investing in government-run hospitals and healthcare infrastructure over implementing the NHI bill. Let's bring in Dr. Honours Mukhari now, who's with the Progressive Professional Forum. Dr. Mukhari, thank you for making time for us. Why do you want the minister to retract this statement?
Thank you very much, Leslie, and thank you for the opportunity, and greetings to your viewers. I'm Dr. Honours Mukhari, as you have indicated. I'm the National Convener of National Health Insurance on behalf of the Professionals Progressive Forum, PPF, which is a body of professionals, different sectors of professionals such as medical doctors, lawyers, and other professionals. We have issued a statement demanding that the statement released on behalf of the minister. We think that at this point in time of the bill, it's a considerable contradiction from the processes that has been followed since the beginning of the NHI bill process. As a Progressive Professionals Forum, we have participated in many different consultations in terms of this bill. From when the bill was presented in Parliament in 2011 as a green paper, in 2015 as a white paper, and in 2019 whereby there was a widespread consultations and public participations. We participated publicly, and we also presented oral presentation in the Health Portfolio Committee in Parliament. Yeah. So our position is based on the fact that a lot of consultation has happened, and we have made a lot of inputs. And during our consultations and debates and inputs that we have made during concerning the bill in the past, the issue of the proposal of just focusing on infrastructure improvement only and not implementing the bill has come from those that are opposed to the bill. And our view has been, and it's always that, the current problems, the current health challenges, both in the public and the private sector, cannot be resolved by simply improving the public infrastructure in the public sector. We believe strongly in what the NHI seeks to achieve, which is to change the current two-tier system.
Okay, Dr. Mukhari, let's look at what the minister said in context, right? He said he would prefer...
It's a cause for the current health challenges.
Just one second.
Country. So we believe that the system should change, not just the infrastructure.
Okay. I want us to look at what the minister said in context. He said he would prefer investing in government-run hospitals and healthcare infrastructure over implementing the NHI bill, because as things stand, the system is under pressure, so it needs strengthening first, and there's currently no sustainable funding source. So it's not that he's against universal health care. Is he not telling the truth here by saying that the public health system is not ready for this?
The public health care system will never be ready. The challenges facing the public health system in the current health system will never be resolved. Because I'll give you an example. The system itself is fundamentally, systematically, and structurally flawed. Because if you look at the way in which it's funded, the current system, the private health sector, it's in terms of spend on the GDP. The current GDP spend on healthcare, for example, is 8.5%. But more than half of it goes to the private health sector, which caters for only a small portion, part of the population. And the other half goes to the public health sector. So on its own, if the system is changed, there's no way in which infrastructure alone can resolve the problems in the public health sector. But what NHI will seek to achieve is that let there be equitable distribution of those resources so that those resources are put into a common pool and they are then used to address the challenges that are there in the sector. Just changing the system itself will not resolve the current challenges. Okay. I will give an example that a per capita expenditure for the private healthcare, for an example, in a year is 27,000 rand per capita per person in the public sector, in the private sector, and in the private sector, it's only 5%. So there's no way in which you can perpetuate or sustain the current system by just improving the infrastructure and not changing the system itself. The problem is not only the infrastructure.
Yes,
the poor infrastructure in the public health sector.
I hear that, Doctor.
It's a consequence of the current system.
I hear that, Dr.
If you don't change the system, there's no way in which you can resolve it.
But you still need to fix. But you still need to fix both systems. You can't want the entire system in its new form to rest on what is working in the private sector. You need the public sector to also be fixed. I mean, look at what the former health ombudsman, Professor Malekgapuru Makgoba, said in his last address. He painted a dire picture of the state of healthcare in the country. In fact, during his term, there's been an increase in the total number of complaints, which is not surprising, because the quality of healthcare delivery in our public hospital has been deteriorating. So is that a healthcare system that's ready for universal health coverage? Because I get you, we need to also repurpose and use the resources we get from the private sector, but you also need to fix this, which has been deteriorating. And what the finance minister is saying is, let's supplement that and fix that and have a reliable funding model before we can even have a conversation. But generally, he agrees that this is a noble cause to go for, but we must be ready for it and have a plan around financing it.
Thank you, Leslie. In order to resolve the current challenges, you don't only need the public healthcare system. The proposal of only focusing on the infrastructure is when you are saying that to resolve the current challenges, it's only to improve the public healthcare system. The National Health Insurance Bill, or the National Health Insurance Bill will use both the public sector and the private sector, because ultimately what you seek to achieve is access. It's access. It's equal access for equal needs. No, so in the private sector, not that the private sector, but both the private sector and the public sector should play a role. So when you look at how it's proposed in terms of its implementation, the first phase of the NHI implementation, it talks about indeed accelerating the improvement of the infrastructure. But that on its own will not be able to resolve the problems. What it's saying that both the public sector and the private sector then will be able to offer services to those that need it. So as infrastructure alone will not resolve that, but when you then use the public sector and the private sector, and then not that the private sector and the public sector will just be, they will have to be able to be of certain standards. So when they meet those standards, then it means that they will be able to be part of the solution.
Yeah,
of the current,
and unfortunately the public health,
as it is now, it cannot be resolved by the public sector alone. It has to. The NHI seeks to use both private. And
unfortunately, the public sector
and the private sector, because you cannot have a situation whereby you're saying, let's first resolve the public sector. The proposal of the National Insurance Bill is that there will be service providers who are in the public sector and the private
yes,
sector.
And you've indicated that both
part of the solution of the current problem.
Dr. Mukhari, we have to
infrastructure, because if you improve the infrastructure, but the challenges will remain the same, and the inequality the gap of inequality will increase, and access will still not be
we're going to have to leave it there, Mr. Mukhari. We're going to have to leave it there because I'm also struggling to get through some questions to you. But Just to remind our viewers that you're speaking of standards that need to be met by both the private and the public sector. The public sector isn't meeting that standard, and the public sector itself, in fact, admits to that. Many health facilities have been failing to meet the norms and standards that health institutions need to comply with before the NHI is implemented. So you cannot want to argue that this public sector is ready to facilitate this NHI when the most basics of the norms and standards aren't met. We've got to leave it there. Thank you for making time for us. That is Dr. Honours Mukhari, who is the Progressive Professional Forum.